Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. I am Bimi Solavoide. I'm a pediatrician and CEO Ask the Pediatricians Foundation. Welcome to those of you who are our regular listeners or who have been watching. For those of you who are joining us for the very first time today, I want to say thank you so much for joining us today. Ask the Pediatrician Hour is brought to you by Ask the Pediatricians Foundation. ATP, we are committed to the health and welfare of your children, and we do that through this health education program online and also offline through our community outreaches. We have lots of channels where you can learn and where you can actually interact and engage with healthcare professionals. So the most common is our Ask the Pediatricians Facebook group. So if you have any questions about the health of your children, you can head over to the group and ask your questions. It's one of the largest parent group on Facebook, and so you're not going to miss it, and you will be sure that whatever answers you get from us, they are evidence-based answers from professionals. So if you have any question from today's program, feel free to ask us. And remember that all these episodes, including our ATP Live Monday, where we actually do live question and answer sessions, they are available on our YouTube channel, on our Facebook pages, on our groups, and you can always go back to them. And some of these topics, you can also read about them on our website, www.askthepediatricians.com. So whichever platform you're watching or you are listening to me this day, I want to say thank you so much for joining us. For those on Fresh Waves Radio and Fresh Waves Radio Facebook page, you're welcome. And for those on Ask the Pediatricians Foundation Facebook page, YouTube channel, and groups, you are also warmly welcome. And for those who are listening on Ask Dr. Baby ATP podcast, you are also warmly welcome. Last week we talked about diphtheria because we're having episodes or like outbreaks of diphtheria in Nigeria currently, and also in some part of Europe there has been some concerns. So we talk about diphtheria, and in the spirit of that, I decided I will still talk more about these vaccine preventable diseases. And today I'm going to be talking about measles. It will interest us to know that these diseases are diseases that we actually have prevention for them. Like we have something that wish owns to give it to your children. They should not have these illnesses, but they are still with us. So that tells us that something is not quite right. And so what I'm trying to do today is to create more awareness on measles. What is measles? How can we prevent measles? How do we treat measles? So I really hope you will take time to join us and listen to the podcast. And if you have any questions, feel free to ask. And those of you who have not listened to the last session's discussion on diphtheria, I encourage you to check it out either on Facebook, on the podcast, or on on our YouTube channel. So welcome everyone. So like I said, today we're going to be talking about measles, and measles is one of what we call the vaccine preventable diseases. So there are illnesses that tends to kill children. We call them killer diseases, and but luckily we found uh, vaccines that can prevent them. So we group them together as vaccine preventable diseases. And just like diphtheria, measles is one of them. So I just give us a little bit of introduction on measles. Most of us are quite familiar with measles. In fact, measles is one condition that parents love to self-diagnose. So usually the most common diagnosis we get made by parents are one, teething. Everything is teething, and the next to it, I think the closest to it, is measles. So every skin rash is often labeled as measles. So once a child has any rash, then it has to be measles. So that is not true. Every skin rash is not measles, and I'm even talking of skin rashes that look like measles kind of rash. Not every rash is measles. So if you really want to know how you can know a child really have measles, then you want to listen today. And why is it important for us to talk about measles? Because measles is one of the very highly contagious and also serious airborne infection, and it's caused by a virus. So in those days when we don't have vaccines, a lot of children die from measles, and even till now a lot of children still die from measles. And apart from death, measles can also lead to malnutrition. And so measles is one condition that, apart from when the measles itself is gone, it tends to leave our children with lots of other complications. It can lead to blindness, it can lead to malnutrition, it can lead to pneumonia, it can cause so many other challenges that we have to now even deal with after we have the measles itself has disappeared. So it is really a very important illness that we need to talk about. And the World Health Organization, WHO, estimated at 56 million deaths were prevented between 2000 and 2021. In the last 20 years, between 2000 and 2021, 56 million children would have died if not because we have the measles vaccine. So thank God for measles vaccine. So 56 million children are living today because they were immunized with measles vaccine. So measles vaccine is a lifesaver. It's a very safe and it's very cost-effective vaccine that is available. And even despite that, we still have about 128,000 children died in 2021 due to measles, and mostly these are children who were not immunized. So most children that die from measles are children who are either not immunized or not fully immunized, because as you will later know, we now give up to 2 doses of measles vaccine. So if you take one, it may not be enough. So make sure you take everything. So we're hoping that more and more children, and the World Health Organization has begun to notice with worry that in 2022, I guess because of the COVID pandemic, about 83% of the world children received only 1 dose of measles vaccine, which is one of the lowest. So it can get better. So measles is very important. So let's talk about measles. So measles is caused by virus infection, the measles virus. So that's one thing. So it's one of those conditions that a pediatrician will tend to call viral symptom. So what we meant by that big jargon is illnesses that tend to come with fever and with rashes, and they're due to viruses. So 3 things: they are caused by viruses, and they tend to come first with fever, and then will follow with rash. However, it's very important for us to know that measles is not the only one that does that. There are many other illnesses, like what we call the German measles or rubella, It also comes with fever and with rashes, even your chicken pox, fever, rashes. So all those kind of illnesses that tend to start with fever and then end up with rashes, we call them viral exanthem. But measles is the most dangerous of them all. Is the one that tends to kill the children. So it's a very, very terrible disease, and it is caused by, it's in the hair. So children get measles by coming, either droplets of other children who already have measles, or by being in contact with them. So usually somebody who has measles, when they cough, when they sneeze, when they breathe, they are releasing the viruses into the hair, and it can be easily caused by any other child who does not have the protection against measles infection. And like I said, it can lead to many complications, especially it can lead to death. And it can affect anyone, but obviously it tends to affect children, which is why those of us who are pediatricians are quite interested. It tends to affect mostly children under the age of 5. And measles tends to start with what we call respiratory infections. Then it will now spread to all the organs in the body and cause problems. So which tie in with the symptoms we tend to say when a child is going to have measles, which is what I'm trying to explain to parents. You cannot quickly jump and say a child has a rash that it is measles. No, because before you see the rash of measles, which is also very distinct, there are some things that will come first. So most time when children get infected with measles, there's a period we call incubation period. So it's a period that the child does not even have any symptoms, but the virus is multiplying inside the body. Then we now start having what we call the prodromal period, where the child now starts having some symptoms, and then we now end up with the period where we actually see the rash, which is when most people will make the diagnosis of measles. But before then, there are things that would have been happening to tell us that this child may actually have measles. So the first symptom most children who have measles have is fever. So it is very, very unlikely for a child who has a rash without fever to have measles. And I think knowing that alone will cancel most of the fake self-diagnosis of measles that most mothers make, or most mothers tend to ask, so my child has a rash, is it measles? Oh, I think my child has measles. In fact, some people don't even ask about rash, they will just say my child has measles because they think every rash is measles. No, every rash is not measles. And if your child did not have fever and now has a rash, it is very, very 99% it is not measles, because measles is a very serious illness, and it will always start with fever. Okay, so a child who is going to have measles rash would have had fever first, and not just fever, the child also have had cough. Most of them have cough, and some of them also have what we call runny nose or catarrh, and then some of them have red eyes. So we tend to talk about the 3 C's of measles and fever. So before a child will have the measles rash, the child would have had fever, usually very high grade fever. It's a fever the child has, the child has fever. They are very high grade, like your 39 and above. And then the child will have this cough, will have this catarrh, they will be dull. They also have, these red eyes. So when they have those symptoms, those are the symptoms that tend to tell us, oh, this may be measles, okay? Because those 3 C's and the fever tends to happen mostly with measles before the child will now have skin rashes. So the most important thing is for us to, so whenever people are asking questions about measles, and they say, my child has a rash, and they will show us a picture of the rash, and it's measles, I always ask, what are the symptoms that your child had first before you saw this rash? So you must tell us first, is there fever or no fever? Was there cough? Was there red eyes? Conjunctivitis? Was there catarrh, running nose? So if those 3 C's are not there, it is very, very unlikely to be measles. And those symptoms would have been there for like 4 to 7 days before the rash will come out. And then there are also some other signs that maybe a doctor will be able to pick up. There is this kind of spot, whitish spot that we see inside the cheek opposite the teeth. A child is going to have measles. So we have other signs that if a doctor examine your child, then they will see. And then before the child will now start having the rashes. Now, let me say that the rash we've seen in measles is not only measles that can give you that kind of a rash. So that's why measles diagnosis cannot be made just purely based on the rash alone. All those other signs are very important to be there before we now see the rash. So the rash in measles tends to start from what we call the hairline. So it starts from the face, but usually the hairline. So if your child is having rashes and it's on their hands and on their legs, there's nothing first on their face, it's very unlikely to be measles rash. Okay, so measles tends to start from the hairline and then it spreads down. So we call it cephalocaudal spread. It spread from the head to the feet. That is a kind of rash, and it tends to be all over the body. And measles rash is this, what we use medical jargon, maculopapular. So some parts look like a different color. You will see it, you can feel it, and there are some parts that looks like you can feel it. So that is the measles rash. So it tends to start from the hairline, the facial area, and then it will, before you know it, it has spread over a couple of days all over the body, and then it will stop in usually to go by itself in 5 to 6 days, and it tends to fade. And when it's fading, it tends to discommate. It tends to give as if the body is peeling. That kind of picture is what you see in measles rash. So that is how you know this is measles. So there are ways by which we as doctors, we can confirm measles is a virus. So we can confirm it with a test, but because the picture of measles is so classical, most time we don't need to do a blood test to confirm measles. And let me let you know that the test for confirmation of measles, it's not something most labs can do. Is because there's a time I think last week, a woman was asking me a question that I think my child has measles, and they went to do the test, child malaria is positive, measles positive. I said that is not possible. Most labs cannot test for measles. Most private hospitals cannot test for measles, and you're not going to get the result of measles right away like that of malaria. Measles kind of test, we send it to special labs, virology labs. It takes them several days before they will give us an answer back. So most of the time, we doctors, pediatricians, we tend to make our diagnosis of measles based on the presentation. A child who is having fever, who is having cough, catarrh, red eyes, and now has a rash that look like the measles rash. Bam, we've made a diagnosis of measles, and we're kind of almost 100% sure, but sometimes we just want to confirm, so we can do the confirmation test, but we don't actually need that confirmation test to be able to make the diagnosis of measles. However, the measles itself, the fever, the cough, catarrh, and the rashes, they are not the problem that is going to kill a child who has measles. Those are the least of our problems. And again, we tend to ask the history of immunization. So when we say a child who has measles, has this child been immunized? And sometimes the answer is no. Sometimes the answer is yes. But remember, because this is also a very popular question parents tend to ask us, oh, my child was immunized with measles. And let me tell you, measles infection is something your child will have only once in life. Okay, it is not one of those conditions that your child it's not like malaria that your child will have over and over and over again. Because I see a lot of parents that will tell me, my child has had measles 3 times, my child has had measles 4 times. No, not true. Your child never had measles. Your child has skin rashes, they were not measles. Your child will not have measles 3-4 times. Usually we say you have measles only once in life, because once you have measles, you should be immunized. Of course, in medicine we say never, so some things are rare. Okay, but we never say things can never happen, but we can almost 100% say for measles it's going to happen only once in your lifetime. So you cannot. So those of you that tend to tell me, oh, my child has had measles 3-4 times, you are not telling the truth. Your child never had measles, which is why I always tell parents on ATP, I don't trust parents telling me my child had measles. I don't take mothers' diagnosis of measles, because most times they'd get it wrong. And I always tell mothers also on ATP, don't take your neighbor's diagnosis of measles, because a lot of people will come to your house. Yo, your child has rash. It is measles. So, and that's they will send you off on the wrong. Then you also come and tell us, so people told me that my baby had measles. It's not true. So don't take people's diagnosis of measles. Don't self-diagnose measles yourself. Only pediatricians, doctors should make those diagnoses. So this is why we tend to get all those, my baby has had measles 3-4 times. It's not true. Your child mostly will have measles just once in their life. Okay. So it's one of those condition that once you have it, you develop what we call a lifelong immunity. So you have it, you should not have it again. The same thing with something similar is chickenpox. You have it, you should not have it again. So it's very, 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 very rare for you to have it again, unless there's something wrong with your immunity and all that. But it's very rare. So once your child has measles once, it's very unlikely for the child to have it again. All right. So but people, I want to quickly answer why I'm here. The question of my child has been immunized against measles. Why is my child having measles again? And again, this is actually what brought us to the point of doing measles doses twice. Before, we used to do one dose of measles at 9 months. Let me confess to say that we were never always sure at what point should we give the measles vaccine. Reason being that if we give the measles vaccine too early, the mother, you as a mom, we believe you should have had measles or you should have been immunized against measles. So you have what we call measles antibodies in your body. And then when you have a baby, you pass those antibodies to your baby. Now, if we give your child a measles vaccine, because what we do when we are giving vaccine, and measles is also one of those vaccines, a life vaccine. So basically, we are giving the measles virus itself. That is what we are giving when we're giving the vaccine. We are giving the measles virus life, but we have kind of modified that virus. So we've modified it in a way that it will not cause the measles infection, but the body will look at it as if your child is having a measles infection, when your child gets immunization, and then the body will be producing antibodies and all that. So, but if your child still have your own antibodies that you gave the baby as a mom for the mothers, it means that when we introduce that measles virus, which is supposed to get the body to produce measles antibodies, the mother's antibodies that is still in the baby's blood, they are going to destroy it. Okay, so which is why we don't want to give measles vaccine too early, because if you give it too early, the mother's antibodies will destroy it. So, and what that means that the body will not have a chance to produce antibodies. So the child has been vaccinated, but the child has not been immunized. So, which is a major problem. So we have a lot of children who may have been vaccinated, but if the mother's antibodies are still very active, so we usually know that mother's antibodies within 3-4 months, they will go away. So which is why we move the measles immunization to 9 months. So we know that by that time, most of the mother's antibodies would have gone away. And when we give the measles vaccine at that point, the mother's antibodies won't destroy them, and the child can develop their own immunity. But the challenge with that method is some babies tend to have measles before 9 months. So which means the mother's antibodies have gone away, maybe around 6 months or earlier in some babies. And so before we give them the measles vaccine, the child could have been exposed to measles, and then the child could have measles infection. And some places, measles tends to happen in what we call every 2 years, there's a measles outbreak, there's an epidemic. And that's why sometimes we also do what we call supplementary measles vaccine for all children 6 to 5 years around that period in those places. So what I'm trying to explain basically is that sometimes we have vaccinated your child, but your child may not have developed immunity for that reason, which I just explained now. In other words, the mother's antibodies is destroying the baby's the vaccine, and it then allow it to. So, which is why we decide, okay, to make sure the baby is covered, we'll give 2 doses. So we give one at 9 months, and we'll give another one at 6 months later at 15 months. So That is Mrs. 2. And hopefully that should give the children better chances of being immunized against measles. So another reason why some babies are vaccinated but not immunized, apart from the mother's antibodies, especially in some parts of Africa, and especially some people go to get your immunization in private hospitals, the cold chain may have been broken. So cold chain is like from the time the vaccine is produced, from the point of production to the point of administration, the vaccine must be maintained at certain temperature, very low degree temperature, usually minus something, -1, minus this. So, but if uh the vaccine at any point, and usually where we keep those vaccines, we have all these thermometers there that monitor that temperature never drops. But if anything happens and that temperature has risen, the vaccine would have been destroyed. So at the end of the day, even though your child was given immunization, your vaccine, but the child was not immunized because the cold chain has been broken. So most health centers, they don't store their vaccines. So I'm talking Nigeria now. Most health centers in Nigeria, they don't store the vaccines. They collect their vaccines straight from the vaccine storage laboratory. Same day they need to give the vaccine. So that way they are sure, because some of this, about in some private hospitals where they keep their vaccines, they take lice, the temperature is going up and down, cold chain has been broken. So I always tell parents, better take your immunization in health centers because you're sure. Of course, I'm not saying all private hospitals do maintain cold chain. Some do, but you can never be sure of some. So these are some of the reasons why some children will be vaccinated but may not still be immunized against measles. And that's why it's possible that even though your child has been vaccinated, your child may still have measles. I hope that really helps. Or I hope I've not confused you more. All right, but just know it's possible for a child who has been immunized to have measles. But the good news is that even though a child who has been immunized or vaccinated, let me use the word vaccinated against measles, still have measles, is likely going to be mild. It's not going to be severe kind of measles. So these complications that tend to happen with measles will not likely happen in those children. So you still have to make sure that your children are vaccinated against measles, okay? So what are the complications, or what are the things that actually happen? Like I said, the fever, the cough, catarrh, and the rashes are not the main problem. Those are not what kill the children. What really kill children are what we don't want to happen to children after measles infection had these complications. One, blindness. Okay, so children who have measles because measles can affect the cornea of the eyes. Also, the vitamin A level will be low in such children. They can go blind. Yes, so measles can cause blindness. So there's no reason why a child should be blind for a condition that we can prevent through immunization. Also, measles as a virus can get into the brain and cause what we call encephalitis, which is like inflammation of the brain. So it is a very serious infection. So when you see a child who has measles and they're becoming unconscious, they're having convulsions, that is not just ordinary measles you are dealing with now. We are now dealing with a complicated measles, what that has entered into the brain and is causing problem, infections in the brain. And this is very important because some people will say, oh, my child has measles, or it's nothing to take to the hospital and all that. This is things you should watch out for. So it's not just the fever is going down, or the cough is going down, or the rashes are clearing up. Watch out for all these serious complications, which is why your child with measles still need to go to the hospital, because we need to make sure the child is not developing blindness, it's not affecting the eyes. We need to make sure it's not affecting the brain. And so if the child is having convulsion and all that, we don't want the child to develop brain damage. All right, it can also cause severe diarrhea and dehydration, because one of the causes of diarrhea in children is actually measles. So because the same rash that you see on the body of the child outside, it also affects what we call the mucous membrane. It affects the lining of the intestine. It affects the high lining, which is why it can cause blindness. It also affects the lining of the guts, and which is what can lead to that diarrhea. And if that is also not properly managed, because children who have measles are not eating well, they don't want to drink, the child can get dehydrated, can go into shock, and that can also lead to death. It can also cause, measles also lowers immunity of a child, especially if a child is already malnourished. So that's why, we pediatrician, we're always talking about weight. The reason why we talk so much about weights of children and the need for you to always make sure that your children have optimum weight at all times is that whenever they're exposed to any illness, if their weight is already low, it's easier for the nails to knock them flat. But if they are, at least they have good weight, they're able to, build up some resistance and fight. So if a child is already malnourished and has measles, the immunity of that child just kind of crash. It crashes completely. And so that can lead to the child having other infections like pneumonia. Again, pneumonia is a killer. So you can imagine having measles, a killer, having pneumonia, another killer is terrible combination. So it can lead to severe breathing problem. And in my experience as a pediatrician, remembering my training days working in children emergency room, most of the children that we lost from measles usually is from the respiratory problem. Once the children start going, they cannot breathe, they have severe pneumonia, we have to put them on oxygen, they are not able to breathe well. That is when we need to start to pray, because we know it is not in God's hand. Some children do rally, but sometimes some children go into what we call respiratory failure. They can't breathe anymore, and that's it. Oxygen cannot get into their body, oxygen cannot get into the brain, to the heart. That is dead. So it happens like that. So measles can lead to all these severe infection, ear infections, pneumonia, and other infections. So these complications of measles are actually the problems that we worry about. The fever and the rash itself is the least of our problem, but all the children have more severe kind of complicated measles. It can those are the ones that we can lose, and which is why we don't want it to even happen at all, rather than having to deal with this complication. Like I said, sometimes when you have dealt with the complication of measles, it's horrible, and at that time you are just hoping for the best. And also, just to let us know that mothers can also have measles. I know I'm talking about the children, but mothers can also have measles. And if a mother who is pregnant have measles, it puts her baby at risk. Baby can be born premature, baby can also be born low birth weight and all that. So all these complications I mentioned about, they are most common in children under the age of 5, and also in adults who are over the age of 30. But it's this, apart from the fact that these complications are common in children under the age of 5, it tends to also affect a certain group of children. I already alluded to one of them, minority children. So children who already have low weight, which is why we always want your baby's weight to be the right weight, because if they should have measles, that's a terrible combination. So children who are malnourished themselves are more prone to having the complications of measles, because they already have low or not enough vitamin A. So the blindness complications, the pneumonia complications, the low immune system, they are going to have terrible complications as a result of that. Also, children who have HIV, and it's also another group of children that tends to become, weak, because children with HIV, children with malnutrition, they have low, weak immune system. So when they have measles, it kind of just knocks them completely flat. And because measles itself is also weakening the immune system. So in a child whose immune system is already weakened and then has measles on top, it's as if the child does not have any reserve to fight any infection. So any infection can come in. Those infections that normally, children are exposed to, but their body immune system just fight it off and you don't even know. Those infections will just be coming. We call them opportunistic infection. They will just be taking advantage of the fact that this child's immune system is already low. So which is the reason we don't even want the children to have the measles in the first instance. So who are the people at risk of having measles? It is children who are not immunized. the children who have not been immunized against measles, either because they've not been vaccinated or they have been vaccinated but they did not develop immunity, which is very, very important, because when it comes to measles, we really need to make that distinction clear. It's not enough to get the injection, which is the vaccination. The child must develop that immunity, and which is why please go for the 2 doses. Okay, the chances of your child developing that immunity is higher if you get the 2 doses. So if you are living in a country where it is MMR that they give, because MMR is measles, mumps, and rubella combined together, please make sure you take the 2 doses as well. It's so important. That will boost your child's immunity. And when there's an epidemic or there's a breakout of measles, please, and we're giving supplementary immunization, which we tend to do in Nigeria every couple of years, and we say all children 6 to 59 months go get a measles vaccine again. Please don't say, oh, but my child has already had 2 doses. Please still collect it. Go take your children and get those vaccines. We have to boost the immunity of the children around that period when the epidemic is high, because sometimes with time immune response tends to wane. So some children were immunized, they have some, but after a while those antibodies are coming down, their level is low. But when we give immunization, we kind of booster it again. So it is still very important, because measles is still very common, especially in Africa, in Asia, we are the ones still battling with measles. That is where majority of measles cases in the world happen, because measles we tend to give it around 9-15 months. So most mothers sometimes they've forgotten about immunization around, once they've gone for the 6, 10, 14, because of the gap between the 14 weeks and the 9 months. Some people have forgotten. Please don't forget, put this on your reminder. And at least once you go through the health center, you have your immunization card. Please always remember to go. It's just like diphtheria as well. Diphtheria and measles, those are the 2 conditions that our mothers we don't tend to complete them, because we forget, or we are just not mindful of it. But we really need to be, so that our children will not get this illness. All right, so I've already talked about how do children get measles. Again, it is in the hair. It's a contagious thing. And the funny thing about measles is that at the time the person who has measles is contagious, the person doesn't have a rash, so people don't even know that the person has measles. So all the children that the child has been exposed to in school, at home, they're already exposed, and people still don't know that the person has rash. So at the time the rashes are coming out, the person has already infected everybody. So, and it is a very highly contagious infection. So it just takes only 1 or 2 hours, for the person, because even the breathing, even the coughing, the sneezing, all those viral droplets, they're everywhere, which is why we always talk about, hand washing. Don't stay in contact with people that are coughing. When your children are coughing, we say please keep them at home, because some of those, if it's like measles, they are going to infect other children. So before the rash, up to 4 days before you see the measles rash, the person is already infecting other people. So sometimes parents will come to the Facebook group and ask, oh, my child has measles, how do I protect the other ones? I'm like, oh, it's too late. Because at the time you're discovering that the child has measles or chickenpox or any of those viral hepatitis, as at the time you are seeing the rash and the diagnosis is being made by the doctors, everybody who has come to the child 4 days prior till that day, they've already been exposed, they've already been they've already contracted the infection. So it's too late. So if they have not been immunized or protected against measles, it's just a game of chance. And like I said, measles can also occur in outbreaks it can spread fast, and then sometimes we have to close down the entire schools, and because almost everybody, all the children in the community are having measles. And when that happens, that is when we tend to lose a lot of children, because when there's an epidemic, a lot of children will die from the measles. Okay, let's talk about how do we treat measles, because a lot of questions are also, my child has measles, what do I give? What do I give? And we get that a lot. The short answer is measles itself is a virus caused by a virus, and it doesn't have any specific drug treatment. So most viruses, we don't have any particular drug for them. So measles doesn't have that. So there's no treatment that is specific for measles. So most of our treatment for measles rely on what we call symptomatic treatments and dealing with complications, preventing and dealing with them. So we don't have any drug that is measles drug per se, but we have to treat all the symptoms and the complications that may come across measles. So the child is having fever, we need to bring down the fever, because if the fever is too high, and like I told you, fever from measles tends to be very high fever, so the child can have convulsion from that fever. High convulsion can lead to continuous convulsion. We can end up with something else with that. So we need to always bring down the fever. So please give paracetamol. You can give paracetamol or ibuprofen. You can give it every 6 hours, to bring down the fever. We can tepid sponge. So you put tepid sponging means using lukewarm water, like the one from your tap, not cold, not hot, just lukewarm water. You can put in like a towel, put it inside the water, and just dab the child's body. As it works with the principle of convection. So as the heat coming from the fever dries up that water, the child's body's temperature will begin to come down. So tepid sponge, expose them, put on flannels, whatever, give them paracetamol, ibuprofen, and that will take care of the fever. Of course, dehydration is another thing we need to make sure they are drinking a lot of water. So usually children who have measles, they are very ill, they don't want to eat, they don't want to drink. So you have to encourage them every few sips of water. So just make sure they are not dehydrated, give them lots of water, give them drinks, even if they don't want only water. It's not the time to pay attention to they have to eat every bowls of food and other. Even if it's just drink, let them take something liquid, let them drink a lot, and that will help them. Also encourage them to eat whatever they like. This is not the time to be like, oh, it has to be variety. If it's just this particular food the child is able to tolerate, is the pap or is the custard or something, soft, easy for them to swallow, that they're able to tolerate, just keep giving them. When they recover, you need to give them extra meals for for another 2 weeks, so that they can recover, because most children will lose weight during this process. So another problem children tend to have is the itching from the rashes. So you can use soothing cream like calamine lotion. You can apply it on them, and that will soothes them from the itching. So give paracetamol, we can apply calamine lotion. Most of the itching in measles is not as severe as that of chicken pox. So most children will not need like antihistamine and all that, but if it's necessary, your doctor can prescribe. But just apply calamine lotion on them. Now, more importantly, we watch out for the complications of measles. And because we know that most measles complication that has to do with blindness is kind of linked to vitamin A deficiency. So when children have measles, routinely we give them vitamin A. We give them on day 1, day 2, and day 14. So we pediatricians, we treat them with vitamin A, because vitamin A also boosts the immunity against the blindness and all that. So once a child has measles, even though I know some of you have taken your vitamin A every 6 months, or some of you taking 2 doses, we will still give a treatment dose of vitamin A now for a child who has measles, because that is at the level where we know immune system is dropping, vitamin A levels has dropped, The child is at risk of blindness, the child is at risk of pneumonia, the child is at risk of meningitis. Vitamin A helps us deal with the pneumonia, with the blindness. So we normally will give vitamin A, and the dose depends on the age of the child, but we give it 3 times. So we give it at day 0, day 1, and day 14. So it has to be given complete like that. This is different from the routine vitamin A that we normally give every 6 months. That one is prevention level, because we don't want your child to have any of the vitamin A deficiencies, blindness, and all that. But if a child already has measles, we already assume vitamin A deficiency, and we have to treat. So we have to make sure the child gets vitamin A, 3 doses. Please don't forget. Some of you always forget the day 14. You must take it 2 weeks after. Okay, so if the child has infections, like if a child already having pneumonia from the measles, is having cough, is breathing fast, when the doctor listens with the stethoscope, they can hear what we call crackles or crepitations in the chest. We have to give antibiotics to treat the pneumonia. So that also has to be treated. If a child had the complications of encephalitis, we have to admit them to the hospital, and we have to treat that as well. So those are the things that we normally do in terms of treating measles. And it's a very intensive, supportive kind of treatment. But like I say, if you say a child who has been partially immunized or immune against measles, they don't tend to have the severe type or complications. Some of them just have the fever, then the rash, and in a few days everything is gone and they're fine. But if it's a child who has never been immunized, who is malnourished, or who already have HIV infection, who has other complications before the measles, those are the children that we battle for their lives. We battle, and I meant that word literally, battle for their life. So it's so important that we don't have to even deal with that, because those are the children we have to admit them to the children to the hospital. Some of them will have to go to intensive care. For example, if they have encephalitis, having very severe respiratory failure from pneumonia, they have to be on. We have to put them on ventilation and all that. So it's a battle for them. So they're having complications of dehydration, shock, and all that. Those are the children that have to be in the hospital. So, like I said, if you notice any of those signs of complications, so your child is not eating, your child is weak, your child is convulsing, the fever is not coming down, the child is struggling to breathe, is having fast difficulty with breathing, those are signs of complications. That child must go to the hospital. And I know there are a lot of lies people have spread. Some will tell you, oh, children who have measles should never be given injection, or they should never be given this or that. Please don't fall for those lies or myths, as I used to call them. So please take your children to the hospital. And some people say, oh, you should not take a child with measles to the hospital. That's not true. Where is the child going to be treated? So you still take the children to the hospital. The doctors will see. If it's a child that they think, oh, it's stable, the child is eating, the child is drinking, the fever is coming down with paracetamol and all that, okay, just calamine lotion, give the vitamin A, okay, you can stay from home and we can monitor. They will let you go home. If the child is having all those signs of those complications that I just talked about, you're going nowhere. We're going to keep you in the hospital, and we have to manage all those complications and hope for the best for that child. We need to make sure the eyes don't get blind. We need to treat, the eyes with all those. We need to give vitamin A and all that. So those children tend to stay in the hospital. Most of us who have elderly children who have mild measles, we may not tend to appreciate what I'm talking about. But those who have non-immunized children who are already malnourished, when they have measles, they are with us for a long time. It's a battle constantly. So they are the ones that we tend to keep with us. All right. So for those who are just joining, I've been talking about measles. So I've talked about the cause of measles, which is the measles virus. It's a highly contagious viral borne respiratory-borne infection. And I've talked about the symptoms, the fever, the cough, the catarrh, the red eyes, or what we call the three C's of measles: cough, catarrh, conjunctivitis, and eye fever. Before the measles rash, what we call the maculopapular rash of measles, which tends to start from the hairline and proceed from the head down to the feet, and it covers the whole body surfaces. And I've talked about the complications of measles: blindness, meningitis, meningoencephalitis, pneumonia, respiratory problems, malnutrition, diarrhea, and all that. And those are the ones that tends to lead to severe what we call morbidity, and also death in children. And now, measles, why I love talk about measles is that all these things I've talked about is preventable. Measles, at least, is one of those conditions that we can prevent because we have a very, very highly effective vaccine for measles. All you need to do is please to make sure that we take our children for this immunization. So in Nigeria, we give measles vaccine at 9 months, and we also give it at 15 months. So we call it measles 1, measles 2. Like I always try to clarify, because a lot of mother will tell me, oh, they gave my baby measles 2 at 9 months instead of measles 1. It's the same vaccine. There's no difference. What we give at 9 months is exactly what we give at 15 months. But we call it measles 1 and measles 2 to tell us which number of them you are taking. So with the first one you're taking at 9 months is measles 1. Then the second dose, which you take at 15 months, is measles 2. The same principle for DPT, Penta, all those vaccines that have 1, 2, 3, or 4 behind them is the same vaccine. It's not different. So don't be worried, oh, they gave my baby Penta 3 instead of Penta 2. It's still the same Penta. It doesn't matter. What matters is that it's the number you're taking. So the number 1, 6 weeks, number 2, 10 weeks. That is for Penta. For measles, number 1 is at 9 months, and number 2 is at 15 months. Some other countries have different schedule. So I know some countries do MMR, and they do MMR1 and MMR2, and the timing they give it is also different from the time we do in Nigeria. So just follow the schedule in your country. Please, you have an immunization card or red book or green book, whatever name you call it, but you have a card or a book where all your children's vaccines are listed. So please always go through those books and look at this sign. Usually when our care workers give our children these vaccines, they normally sign, they even write the batch number, everything, so that we can trace that they actually gave the vaccine. So please always check that it is written and it is signed. And sometimes they would have written the date for the next dose. Please put those dates in your calendar. Please don't forget them. It's so important that you give your children this measles vaccine. And if you're living in a place where there's currently an outbreak of measles, or we're doing what we call supplementary vaccination against measles, usually we do them in Lagos, in Nigeria, most part of Nigeria, every couple of years, because we tend to have measles outbreak every 2 years. Please make sure you take your 6 to 5 years for those boosters or those supplementary vaccination. It doesn't matter that they've taken measles 1 and measles 2. Still take them, okay? And make sure they get those immunization. So this routine immunization with the mass immunization or the supplementary one that we do when there's an outbreak is supposed to protect our children. They are highly, highly crucial for reducing the deaths due to measles. And that is why we were able to prevent 56 million deaths in 2001 to 2021. So that is massive. All right. And unfortunately, these days, we are having a lot of false news, or how would I call it, conspiracy theories and all that. And some people, even places like Europe, where most of these infections don't happen again because people were immunized over the years, and the rates of immunization is quite high, 90%. We're not even near there in Africa. A lot of people are now saying, oh, your children don't need a vaccine, blah, blah, blah. And we are now having measles outbreak. in Europe. And that is you can Google some of this information, and that is telling us that we cannot afford to relax and say, oh, we've already been doing the measles vaccination, I don't need to give it again. Because when we don't, we're going to start having the measles outbreak that places like England and they've not had it for several years. But because people begin to spread the news against immunization, and a lot of people are buying into those false misinformation, they are not having measles outbreak. Also, all these refugees and people that are in camps and all that, they also tend to have outbreak of measles, because sometimes people that are in those situations, those who are escaping from wars, from refugees, they don't have opportunities to get immunization. They're always on the move and all that. But though the government is supposed to go there and make sure they get all those children, IDPs, internally displaced persons, or refugees, they need to make sure that they immunize them in their camps. So, but if you're not in that situation, really, there's no reason, no excuse for not giving your children immunization. So measles is a vaccine preventable disease. No child should have measles. No child should die from measles. All we need to do is to make sure that we take our children for immunization. Thank you so much. If you have any questions about measles or measles immunization or any other topics that I've talked about, feel free to head over to our Ask the Pediatricians Facebook group, post your questions there, and I will do my best to answer them in the next as soon as possible. I want to remind us before I go off the air today about our ATP Schools First Aid Care project. We are going to our secondary schools all over Nigeria in October and for many months to come, and trying to teach our students about first aid care. What do you do if somebody is having a medical emergency near you? We see all sorts of misinformation, all sorts of errors when people have emergencies. People don't even know what to do. So once you start catching them young and teaching them the right thing, and we really need your support. And you can help us by donating to our accounts showing on your screen. We have our Naira account, we have our dollar account, or you can go over to our global giving page. The link is also there. Feel free to donate to us. In whichever country you are, we can take money from any country via global giving, and also we can take money direct donations to our accounts in Nigeria. Please, if you're also a corporate organization and you want to partner with us on this project, please feel free to reach us on our WhatsApp number or we email askthepediatricians@gmail.com. God bless you as you support us. So till I come your way again next week with another fresh episode of Ask the Pediatrician Hour, where I'll be talking again about another important topic. Most likely I may still stay with this theme of vaccine preventable diseases. Feel free to keep learning more, and let us know if you have any questions, and we'll try our best to answer them. Thank you so much for listening to me, and have a wonderful day. And it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.